You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, what you need to know if you've been told you need spinal fusion surgery. According to my first guest, there are two ways to do it. One, you open up the back, lots of downtime, lots of trauma, or one where you can go minimally invasive through small incisions, through holes, and the downtime is much less, but more importantly, the results have proved to be better. With us, we have neurosurgeon. He's been on the program before. He is America's go-to spine surgeon. With us, we have Dr. Hamid Abbasi. Dr. Abbasi, welcome to the program.
Well, it's my pleasure to be on your show, Randy.
Good. Now, you get a lot of attention, and I'm trying not to side with you, but you get a lot of attention. I mean, you're all over the news, you're in print, and so thanks for coming on the show. But you say it's kind of, we talked in the green room, like this is kind of a movement that's going on, these new low downtime, minimally invasive surgeries.
Well, the thing is, patients understand now better than ever how to get their information for their health-related issues. And when they go regarding the spine, they understand that they don't have to suffer anymore, and they don't have to go through a tremendous amount of injury to get better. And I think that is why we have becoming very prominent in the internet.
Okay.
And people, and as well surgeons, not only from the United States, but around the world, they are now flocking around us to see what this is about. It's a big buzz going out there.
Okay. Now, at the top of the show, I talked about there's people in pain that don't have to be. Mm-hmm. But with some of the limited research, and these could be up at about 500, I was told just yesterday, about close to 500,000 lumbar spine surgeries are being done a year, the old-fashioned big open way, every single day. 25 will be done today. You say there's a better way with less downtime, less blood loss, and better, ultimately, results.
The data you're reciting is actually from Medicare for Disease, and it's from 2015 that says about 1 million spine surgeries are performed annually in the United States, and 500,000 of them are spinal fusion. And for lack of other term, I think the Lord put our spine in the wrong place.
What do you mean?
It just takes a lots of work to get there and get to where the problem is. We have to either fillet you up open from your back or open you up your belly and so on. But as well, we have grown tremendous in our technology. Now we can get to where we need to be through a very small tube that is a little bigger than the pen you are holding in your hand, and that has been a triumph of technology, how we can now get to the deepest place in our body with the minimal damage, and the beneficiary of that are patients who can play with their kids in weeks rather than years.
Now, it's like you told me, do you want to be on the golf course in a month, or do you want to be on the golf course in a year? And that's the difference between, there's only like about, less than 30 guys in the country that even do this type of fusion. Is that true?
It is absolutely true. And Randy, it is a big deal to go inside of you within millimeter from your spinal cord, correct your problem and not damage you. For that, we learn to open it up and look at everything.
And by the way, to correct me if I'm wrong, because this is what I learned from you. You say that they cut people open and, as you say, fillet them open. Also, the surgeon could see what they're doing.
Yes, it's all about.
But that's the best way, it seems. You could see what you're doing.
Well, obviously, the surgeon need to see. So I used to do it that way with the big open surgery, so I can see all the anatomy. The magic is now that we can do it with the smaller incision and give the patient the benefit of much less injury to the tissue.
So I've seen some of your slides. It's like, like 6 little holes, incisions.
Yes.
And what are you looking at? Are you able to see as good as those guys that open the whole back up?
I can see much better than with the open surgery because, as you know, even in the biggest field of surgery, you are limited to the surface. Like if you have blood or smoke, and we literally in open surgery, we cook the tissue with electricity, and that creates smokes. I know it sounds crazy, but that is the reality of that. Now, all of that obscure my view. With the machines, with the X-ray machines, I can look inside of you, past all the blood.
So you're like looking at a monitor while you're doing this?
I'm a Superman. I look inside of you with my X-ray vision.
Can you put, what about, it's like my friend I told you, he had back surgery. He said, but you can't put hardware in there, those were his terms, through these small holes, can you?
Absolutely. And that has been the triumph of technology to enable us to do things that even some of our surgeons, not only your friend, cannot wrap their head around that. The best story I got is a patient of mine had an accident, went to the ER, and they consulted the local neurosurgeon. The local neurosurgeon looks at the films, look at the patient, says, "Are you sure is this the right patient? Because I cannot imagine how all the hardware got inside of the patient." But
through the small holes.
Through the small holes. But that is what we do. That is who we are. It takes a lot of education, but we do it every day.
So people that literally were stuck on the couch or in walkers, with in some of the cases, now they're back to activity at the gym, golfing, whatever. Is that routine?
Randy,
for you?
It is miserable to be in pain. And my patients are a testimonial toward how hard it is to be in pain, and their family pay for that too. But now we see that patients come back to me that they say, "I can play with my grandchildren, I can do gardening, I can do things that for years I couldn't do." A young patient of mine just told me, "I can hold a job." How much more basic is it in your life or anybody's life to be able to function enough to hold a job? He gave me the biggest smile of my day in that day when she told me that finally she could hold a job.
Okay, now we want to get into, before we get off, apparently people that weigh 300, 400, 500 pounds are told you can't do this. But in your hands, they can.
Absolutely.
So let's talk in detail about that, because you did in fact, you have a video of a 500-pound man that had this done.
Yes.
And said he was out of pain that day.
Mm-hmm.
Also, if you're 85 years old, surgeons are afraid to touch you. It's routine for you. You say instead of 7 hours on the table, correct me if I'm wrong, you say you can do in certain cases under 40 minutes. Less blood loss, things like that. And instead of staying in the hospital for a week, maybe a day and a half.
A day and a half. As a matter of fact, our average hospital stay is 1.6 days. We have tremendous amount of data that we have moved beyond the gut feeling and the anecdotal level of evidence. We have tremendous amount of data that we can provide safely a surgery that would be deadly in open old-fashioned surgery, like the 500-pound patient you were referring to, was told by a panel of surgeons in Cleveland Clinic, which is one of the highest name on the planet for medicine, that he will die of that surgery. He cannot have that surgery done. And another good day for me was when the mother was telling me I gave her son back because he can walk again. He woke up and the leg pain was gone. The surgery that he was told it was deadly, he was discharged from the hospital 2 days later, flew back home 4 days later. And I have that picture of that mother with a tear in her eyes when she has the son back, when she sees that the son can perform at the basic level again, he has not been able to do for years. And I would totally understand why the biggest places of the practicing medicine in the United States would say they cannot do that surgery. That surgery for a 500-pound patient is truly deadly. And I used to do that surgery. I know what that means.
So you would have probably turned him away as well?
At that time, I would have.
Because the risk of all the blood loss and opening up his entire back, cutting muscles.
And even laying on your chest, on your lung for that long, your lung will not recover from if you are 500 pounds or even 300 pounds, your lung will not recover if you're laying on it for that long.
So
you just make that long surgery
okay,
shorter.
so how is your surgery that much different?
You know, I don't cut the muscle, I don't cook the muscle, I don't cause the bleeding. So within minutes, I am where an open old-fashioned spine surgeon needs hours work to just get in. You remember I told you that Lord put the spine in the wrong place? But
it's hard to get to.
But as well, he gave us the tools to get there within minutes, not within hours.
Let's back up for a moment so people at home know. At what point, like what has to be going wrong for a person to even be suggested that they need fusion surgery?
When you sit and you're in pain, when you move and you're in pain, when you try to do basic daily activity and you have pain in your spine that doesn't let you live your life, most of the time the problem is that the disc that separates the bone has stopped working properly. Many times we support the spine for you not to need the surgery. Many times we help the patient by just trimming that disc and they'll get rid of what's pushing on the nerve. But sometimes that disc is so destroyed that the only way to treat that is getting rid of that disc completely. And that is where we can do that surgery.
So these discs,
yes,
they go in between the bony structures of the spine. They kind of, like you said, like a flat tire.
Yes, yes.
So when somebody's bone on bone, or their discs are gone,
yeah,
their only option is like a fusion in many cases.
By the time you need truly a fusion, you don't have a flat tire. You have no tire. You're driving on a rim. Your bones are grinding the bone, and that's extremely painful condition. That is when you need us. And with the fusion surgery, now there are open and minimal invasive ways of treating that condition. And I think we have enough data to show that in every category, we can provide better result to the patient much faster without destroying and causing too much collateral damage.
You're putting in a way like scaffolding.
Yes.
So if it's bone on bone, you're kind of putting hardware in there that eliminates, or what? What are you doing?
Well,
like, how does the fusion work is what I'm asking.
The fusion works when you get rid of a bad disc that's non-functional, permanently non-functional anymore. Because imagine if that disc is there but is not really working, the pieces of that disc are going to just fly around. I'm using the term fly around, nothing really fly around in you, but it pushes on the structure that are surrounding that disc.
The nerves?
And that is the most important piece, that the nerves are just in the close proximity to those discs, and pressure on the nerves not only is extremely painful, but practically it causes you lose function. Like you cannot use your muscles, you cannot walk, you cannot go to bathroom. Basic function of your body is controlled by nerves, and if those pieces of material of the disc just go randomly push on those nerves, that practically prevent you of performing as a normal person.
So the fusion does what?
The fusion actually get rid of those pieces of the disc that are not functional anymore. It lifts two bones against each other.
So it lifts it, like separates it?
Oh yes. Some of our patients are 2 inches taller after we are done with the big surgery. Not that's the reason we do the surgery, but they come and say, I measured myself, I'm taller and I'm straighter, I'm standing up. My neighbor told me, I have never seen you like this, because the posture changed there, and they're truly taller. And the way we do that is by putting a piece of very specialized metal where the disc used to be, and lift up those two bones against each other. And by doing that as well, we get rid of the pressure on the nerve.
So that the pain goes away.
And that is why they wake up and tell me, my leg pain is gone. What did you do? And has been actually very tremendously beneficial to the patient, because they can walk. All of a sudden they wake up and within hours of my surgery they walk. Whereas we know that after open old-fashioned surgery, it takes so much longer for them to be able to walk. But we have tremendous data that we show that our patients wake up and the leg pain is gone right away, and they ambulate, 96% of them, within the first 24 hours.
What does that mean? That means you get out of the hospital.
That means you can go home. If you cannot walk, you cannot go home.
And they feel better right away.
And that part, based on the direct pressure on the nerve, that symptoms are corrected almost immediately. It's almost like magic. They wake up, the leg pain they had for years is gone. They couldn't walk for 5 minutes. They couldn't stand for 5 minutes. And all of a sudden, they go around the floor in the hospital or surgery center, and they look at their legs and they don't believe what's happening.
The pain's gone.
The pain is gone. I can walk again. And even though they still have some surgical pain, but that pain that for years prevented them to perform at the basic level, that is gone.
Spinal cord stimulation, where you literally confuse the signal to the brain. Sounds great to me.
Another fantastic procedure for selected group of people where they have a neuropathic pain, like burning pain in certain areas and so on. I just can't make my patient understand that the pain is a signal that something is wrong.
So if you're bone on bone, the spinal cord stimulation may block the signal, but you still have the problem.
You still have the problem. And
Okay.
it's a bandit, it's covering the reason for the pain, but sometimes we still do that if we cannot fix them in any different way. But if you can put the fire out, you shouldn't cover the noise of the smoke alarm.
So as a neurosurgeon, you do all these minimally invasive things.
These are all repertoire of any
It's all a judgment call on
neurosurgeon.
your part of what
Correct.
technology to use.
And, and I think that is our advantage, that the reason we choose a surgery for the patient is not our ability, is about what the patient truly needs.
You mentioned 3-level. I don't really know what that means, but I'm guessing what it means. But a 3-level. I was told, Randy, maybe on a, because I ran this by a few of my buddies.
Yeah.
My interventional pain guys. They're going, I don't think you could do more than a 2-level minimally invasively. But you can.
Well, we have done 7 levels minimal invasive.
Through these small incisions?
Through the small incision. That is how far we have come. Now, you were just, Randy, showing me up this beautiful set here in your thing, and you were telling me how expensive those cameras used to be and how the technology has moved now. You were showing me your new iPhone, that how much of this big technology is now concentrated in your just cell phone. Our technology is not only has improved in your cell phone technology or camera technology. Medicine as well has come a long way.
So there's only 30 guys, is that true? Less than 30 guys that know how to do what we're talking about.
And we have trained
is
one-fourth
that
of
true?
them. Absolutely, yes.
And you've trained all of them?
No,
Most
I have trained 1/4 of them. But that is exactly the difference. The difference is doing that surgery for 2-level or 7-level, doing it for a scoliosis or for a regular case. This is where what we have been able to do is never enough for us to do the right thing for our patient.
I have a friend, this is about scoliosis, 65 years old. Pretty healthy guy that I know of. He runs and everything else, but he's got severe scoliosis and he's starting to get pain. He was told he's too old for surgery. It's too risky. Would you say that? I know you don't know his medical history, but not a problem.
That age by no means is a limiting factor for us to provide care. Neither the diagnosis of scoliosis. For many other minimally invasive.
But can you do that with minimally invasive?
Absolutely,
Scoliosis?
you can do it all the time.
The same technique.
And if I double it up for you. I do it even in situation that patient has comorbidities that cannot help with any kind of surgery at all. Like a Jehovah's Witness who had to come to us after 4 surgeons told her, you will bleed and die on
because
the
they
table.
can't get blood transfusions.
The Jehovah's Witnesses, they cannot have blood transfusion.
Okay.
They have to choose between their faith and their health. They don't have to. Even in those situations, that patient had a much bigger surgery than 3-level, has a scoliosis, and was told
Did you do it?
I did it. Not only that, we have a testimonial of the patient. 1 month after the surgery, that patient drove 400 miles 2 days after the surgery to go home and could do that, and is back to life, to fullest life, within just a month or 2 after the surgery. This is as close to medical miracle in the spine it can come.
So there's 500,000 or more people that are in pain that could benefit from a fusion surgery, but because of their weight, they weigh 250 pounds plus, 300 pounds plus, they're doing nothing. And you don't like that. I don't want to put words in your mouth, but tell me about that. Like, what do they go through if they do nothing?
So, Randy, we as surgeons are the most trained people to provide certain kind of care to our patient.
Okay.
And it breaks my heart every time I have to tell my patient, I cannot help them. And it used to be a lot. I used to tell my patient a lot, you need a surgery, but you're too big, you're too old, you're too sick for a surgery, because I have to weigh the risk versus benefit.
Okay.
Am I really helping you with my surgery? And many times the answer to that was the surgery will help you, but the collateral damage of the surgery will get you down. You will not sometimes survive that kind of surgery. Now, imagine now my happiness that I can reduce the side effect, the risks of the surgery to a level that all of a sudden I can help a 400-pound patient or a 90-year-old nun that is all independent now after my surgery and can live again and perform and get back to what they really enjoy in their life. For some people is golfing, for some people is doing carpentry, for some people is gardening. But by us being able to make the surgery less risky, we can now help people that truthfully have been told by my good, well-intentioned colleagues, the surgery is just too dangerous for you.
Okay, somebody watching this, they've been told you probably need a fusion, but there's just no way. What's their life going to be like to stay out of pain?
Well, how do we treat the pain? We give them medication. That medication slows you down. Your relationship with your family changes. Your spouse cannot stand you anymore because you cannot participate in any meaningful way in the family life. You cannot go pick up your children. You cannot go grocery. You cannot go for a vacation.
I had a guy tell me on this show, and he said, we're making them unknowingly, or we're making these people addicts.
We make them zombies. That's what we make them. By not giving them a care that they truly need to perform at the basic level that you and I take granted.
So this minimally invasive, what do you call it, by the way? This minimally invasive
surgery? We call it inspired Spinal.
Okay.
That's what we call it.
Okay, and so basically, for people just tuning in, there's two ways to get a fusion surgery. A surgeon has to open you up as wide as they can so they can see it. Probably a little suction thing to get the blood out of the way.
Yeah, not a little, a lot of blood.
And you can lose close to a gallon of blood, according to you. And
it takes certain scoliosis surgery, yes.
It could take 6 or 7 hours to do these surgeries. You do it in some cases under 40 minutes. Less blood loss, and you're not damaging or detaching muscles and things like that. Do I have it right?
You absolutely have it right.
I know the big benefit is low downtime. Downtime's right away. But what about results? I mean, if you had to stack the standard way, 500,000 of these are done, against this way you're doing it, closed, through, minimally invasive, how do you stack up as far as results? Like, who has more activity? Who has better support on the spine?
It compares, the open old-fashioned surgery compares to inspired Spinal the way I would compare in a match fight to Arnold Schwarzenegger 40 years ago. That is how it stands up to the open old-fashioned surgery cannot keep up at any level. It just gets smashed down because we lose 1/10 of the blood. Our surgery time is so much shorter, so the lung recovers so much faster.
The traditional spinal fusion that's being done every day across America, 500,000 of them, it leaves you with permanent damage and yours doesn't. What do you mean by that? Could you clarify that?
Randy, in an open old-fashioned surgery, when we cut those muscles, we do not reattach them. Those muscles literally die and turn into scar. Practically,
so you have to cut muscles.
We have to, and then we cook them to stop the bleeding. But those muscles now are turned into scar. They have no function anymore, and they cannot help you in your life. That is already a significant permanent damage.
So mobility is affected?
Imagine you had the shoulder surgery and the surgeon doesn't reattach the muscle in your shoulder. Your shoulder will be rendered physiologically dead. This is what we do to the spine with the open old-fashioned surgery.
And with yours?
Not a single
You're just kind of moving
muscles.
Things out of the way?
We just dilate those muscles gently. By the time we take our tubes back, they fall back, and we have a good evidence that practically scarless toward the muscle of the spine. Our surgery is scarless.
What if a person's watching this? They have great doctors. They've been to all the famous teaching hospitals that don't offer this yet. What if they say, well, if this was good, I would have heard about it before? Yes. What do you say to those people?
Well, it comes all back to that it is hard. It's a big, tremendous amount of training goes into learning this. Okay. And we have put actually an educational protocol to teach it to anybody who wants to learn that. So with us, not only the patient are getting this kind of care, but they're getting the care from people who teach it to other people.
Is this the future of fusion surgery? Like whether it's 50 years or 100 years?
No question.
This will be done this way?
No question. And I don't believe that's going to take 50 years or 20 years. I think in 5 years, we will look back and call ourselves barbarian for doing open old-fashioned surgery and destroying your entire spine to just fix a problem.
And insurance is covering this. I mean, with Medicare
Yes.
Advantage programs specific to your situation, it's covered.
Yes.
Is that right? In most
Yes.
cases?
Yes.
Do you have patients, I'm calling it bone on bone, but people that say your discs are gone, that you've done this minimally invasive surgery on, that now are doing like weekend warrior kind of stuff, like cycling or swimming?
Yeah.
I mean, do you have that? I mean, people
have-
that were really bad off.
We have thousands testimonial that people get back. The 73-year-old person who get back into marathon. We have the
Really?
cyclist. We have we talked about the 89-year-old biker who want to go to Sturgis. We have been showing with tremendous amount of data that we can put patient back on their life faster than any other spinal procedure out there.
Okay, somebody watching this, they're saying their doctor said you need to lose 100 pounds before you do this. Or somebody 80 years old watching this and they were told you're too old, the risk outweighs the benefit. What do you say to those two groups that you say are perfect candidates in many cases for this?
Come to us, let us show you our results, let us discuss a specific problem you have, but neither the age nor the weight has been anymore a limitation with the technology that we are offering our patients.
My understanding is people that get one spinal surgery, like a fusion 5-10 years ago, now they need another one. They're told you need another one. But they say no way because of what they went through. But you say you see these people all the time.
Yes.
Tell me about that. And what's it like for them?
We have helped thousands of patients in this specific situation where with the technology we can as well, for people who had a previous surgery, provide this minimally invasive surgery. And as a matter of fact, Randy, those are my most thankful patients.
Really?
Because they know what the alternatives are and how much different is the recovery and regaining their daily life is comparing to open old-fashioned surgery.
So for those people especially,
Those are the most thankful and appreciative patient of mine because they can truly, on their life, on their body, can see the differences.
if what you're saying is true, there's 500,000 people a year getting
Just in the United
this
States.
old barbaric surgery when they could be getting it done minimally invasively.
Just in the United
And
States.
get better results with less damage, less scar tissue, less blood loss, less infection risk.
And we have the data to prove it.
Okay, now we're out of time. I want to thank you for coming on the show. Final message, somebody is in a lot of pain, but they don't want surgery. But let's say they've been diagnosed elsewhere, you need fusion. What do you say to them? They're afraid.
Come to us and let us show you your options.
Okay, Dr. Abbasi, always a pleasure to have you on the show.
Thank
Good
you.
stuff. You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.